Hello.
All right, so our agenda for today, we're going to begin by just getting an overview of some of the CDC guidance and what's happening here in Palm Beach County. So Dr. Alonso is going to walk us through that. And then following her presentation, I'll go ahead and start talking about what we're doing here to maintain access to health and human services, particularly what we're doing around isolation and maintaining services for food and transportation and behavioral health and some other things. And then we'll have Julia, who's the executive director for CareerSource, that will provide an update on what's happening with unemployment and that surge that we're expecting. And then finally, we'll have Randy Palo, who will give us some additional information on the funders group and give you an update there. So I'm going to just turn this over to Dr. Alonso and let her walk you through what we should be doing to prevent the spread, and then I'll take over from this.
Let's see, let me put this so you get my best features.
Oh, Dr. Alonso.
Do not want to call this coming from the bottom up. Okay, can everybody, yes, there I am, all right. Well, good afternoon, I'm very happy to be here. I will try to answer as many questions as I can, but why some of these things are important and how we're using the data that we have in order to make decisions in terms of what we're doing here locally, as well as what we're doing nationally. So let's see if I can get this to slide up so I can give you the global numbers, which I can't make it do it right now. Okay, in the world right now, the global numbers are 495,086 global cases of coronavirus. Somebody's not muted. Deaths are 22,295. So the fatality rate globally has been as high as 4%. And that is a very high mortality rate. If you think of this as the flu, we have in the US between 32 to 59,000 cases of people dying from the flu. And this is a type of flu. In 2009, we had H1N1, which started exactly the way this started. Influenza start in the East, and then they make their way globally to Europe and to the United States and to the North America. Winter. In the summer becomes our summer, the virus goes down, doesn't go away. Understand that the virus does not go away. What happens is that it goes to the south of the hemisphere because it's winter in the southern hemisphere. And then in the following winter, it will come back up again. And so during H1N1, we had a period of about 6 months where we were dealing with the virus. It got cold in the summer. It went away. It went down to the southern hemisphere. When it came back that winter, we had a really hard time because people had forgotten about it. Forget that the virus is going to do exactly what other viruses do, and it will do that. Now, in terms of the US, our numbers now are 69,684, and the death rate, the number of death is 1,049. So as you can see, that ratio is much, much smaller than the percentage in the global. Why? Well, we have, even though people can complain about our medical system, we have a better standard of life in the United States than a lot of the European countries, including some of the Eastern countries, and certainly countries like Iran and other places that have very, very medical system. So it is logical that we're not going to be as affected as Europe and the far. In terms of Florida, our numbers now, we have reached in Florida a total of, this thing is going away again, 2,355 cases, of which 2,235 are positive residents. So that's, and 120 are people who are not in Florida. So our total cases in Florida is 2,355, and we've had 28 deaths. So if you do that calculation for Florida, again, our death rate is lower than what you're expecting in Europe. Now, when you bring it down to the county level, in Palm Beach County, we got a big peak today of 169. They went up quite a bit. Out of those residents, 160 of those 169 are residents that live here in Palm Beach County. We have one resident that is not in Florida, but the cases are defined by their permanent home address. So this person that's not in Florida does get counted among our cases. And we also have 8 cases that are not residents of Florida, but they're here at this time. So in terms of what do these people look like in terms of demographic, we have an age range from 6 years old to 88. Now that 6-year-old was not a person that was sick. It was a child that was part of a family who had traveled to Europe. One of the members was did come down with symptoms, and because the family had the resources, they sent their test up to New York, and out of the whole family, she was the only one that came back positive, but she was completely asymptomatic the entire time. So children can get, and we know that children can get the virus, but it appears that children do very well with the virus.
Never get any symptoms before you test negative.
It means that they have no symptoms, correct? So that is very reassuring for children that we know that they appear to handle this virus very well. The age range then, the average age that we have here in Florida, because of that one child that was 6 years old, brings the average age down to 49, but that's a statistics number. Most of the people are much older, okay? We're talking 65 and above. That's why we have made the criteria for people getting tested to be 65 and older and have symptoms in order for them to qualify to be tested. And I'll talk a lot more about testing in a moment. Right now, the breakdown is 99 cases are men, 68 are women. Other counties have that ratio reversed. I think the women are catching up a little bit in Palm Beach County with the guys, and there's no reason for men to be more susceptible to the virus than women. I just think that's just how we've been testing. Now, the fact that we've been testing very little says to me, and I have to, when we make decisions here, I know that there's a lot more cases in Palm Beach County than those that we're reporting. One of the things that we use to project is we look at how many cases are travel related and how many have no history of any travel or coming in contact with anybody, and have no connection to a positive person. In the beginning, every single one of our cases was related to a case or had traveled outside of the country. Now, out of the 169 people, we only have 35 cases that are travel related. 31 have no travel-related history whatsoever, and 103 have no information at all that relates them to anything. So that means we have 134 cases out of the 169 that what we consider community spread. Okay, they got it by coming in contact with someone in the community, someone they don't know, out in the shopping center, out on Clematis as they're hanging out drinking, out on the sandbar, down partying. And so that's what guided us to make that decision. Once we saw the community spread, make the decisions to start clamping down on talking more about social isolation. But from the very beginning, we mentioned that the only way to deal with an epidemic that has no medical treatment, no antivirals, has to be by people isolating themselves and using the same concept that we use with HIV in the early part of the infection, where you have to assume that everybody you're coming into contact with is positive. If you do that, then you're going to be washing your hands, making sure that you don't bring your hands to your face. That's how you're going to catch it. The virus doesn't go through your skin. It is it's called a droplet transmission. It's not like TB that it'll go up into your vents and contaminate other rooms and other areas. It literally has to be caught from sneezing or coughing on you, or you're touching something that has the virus still alive on it. There's a lot of controversy in terms of how long will that virus be viable. When you look at a virus under a microscope, you see that as soon as it dries out, it actually shrivels up and dies. So is it possible for the virus to sustain and still be transmittable to another person on a surface for a longer part of time? Theoretically, yes, but not likely.
Make sure that you mute.
Something's going on technically. I have nothing to do with it. I didn't break it.
So, all right. Okay, you good. You're good. It's-
Wait, but you're sharing that screen.
Put it back on here. There we go. All right. Oh, okay. Okay, can I keep talking?
Yes, you can.
All right. 'Cause they'll all fall asleep if I maybe. Okay, so I'm giving you that information because a lot of people have a lot of concerns about, do I have to wash my boxes, especially if they're Amazon and coming from China? No, you don't. There's no way that virus is still going to be coming from China in the box. What you do is you wash your hands, you wash where you're going out and touching things in public, and don't rely on somebody else have it cleaned it for you. You take your own responsibility in cleaning your hands. And of course, you should always clean your hands with soap and water. That's the way to wash your hands. And we talk about the 20 seconds, make sure you're washing them long enough for the stuff to come off. You don't have to use hot water. Somebody told me we don't have hot water. Oh my God, we're all gonna die. The reason you wash your hands is it's a mechanical motion that gets rid of bacteria and viruses on your hands. So that means that you wash your hands, you want the water flowing down so that as you wash your hands, the stuff comes off of it. The other thing is that you're going to stay away from crowds. And that's why we have put in the measurements that we have put in terms of closing things that would stop people from being close to crowds. Bars, movie theaters, obviously there's no way really to stay away from other people and you're in a confined area. So watch where you go, try to stay away from the crowds, stay home as much as possible until the summer gets here and we'll be allowed to go back to the beach. You want me to give any other statistical stuff, or is
I
that pretty
think-
much it?
I think
You're going to
so.
talk about the
Right
other
here.
slides. There's a lot of other information in terms of
Yes.
some of the stuff we're talking about.
Yeah, so if you walk through this, so isolate, you've already walked through this.
Yeah. So once you, let's say you get sick, okay? We're screening, for example, here in the Emergency Operations Center, we're screening folks when they come in. We're asking them some questions and we're taking their temperature. I think that's a very good screening tool. We're doing that in our clinics. All patients coming into our clinics are being screened for temperature. Doctors' offices are telling people not to come into their clinics without calling first. My nephew's son this morning had to be picked up because he was running a temperature. He was running quite a high temperature. He was very uncomfortable. His temperature did come down with Tylenol, but he was still running a temperature. They called me freaking out. Oh my God, he's got COVID. I said, no, he's a little boy. Most likely he had a little sore throat the other day. He probably has strep throat. Oh, but what if he has, I mean, they were freaking out. Okay. I said, call your doctor, let them talk and call me later. So they did, they called, the child was told they were going to drive through. They talked to them. They did a telemedicine interview. They got all the details. And they said to them, most likely he has strep throat, thank God. And they then drove through and they did the strep throat test. As they drove outside, they went to the car, took his little sample, they waited. He was positive for strep throat. He got his antibiotics and he went home. So that's the way we're handling our clinics right now. That's the way the private sector are also handling their offices. We have had a huge problem where the private sector has refused to test. I can't fix that. I can't fix doctors not doing what they should be doing. And so that answers the question that Jen just asked is, aren't the numbers potentially higher because people can't be tested? Absolutely. That's why I made the statement, we need to assume that anybody that you're in contact with outside or even in your home, you should all assume that you could be positive. The majority of the people are going to have this and just get over it as a common cold. About 3% less will have the fever and the symptoms and therefore be sick. What are you going to do then if you get that? You don't have to run out and get tested. All you have to do is stay home, stay isolated. So if you're home and you have 3 or 4 other family members, maybe you would stay in your bedroom. You should set up and plan this ahead of time. How are you going to take care of it? You're going to stay home for at least 14 days to make sure that you're over it at the end. For the fever, I recommend people take acetaminophen, drink lots of water. So you want to stay hydrated and you get rest. It's time to catch up on Netflix or whatever else you may want to do at home. Maybe you guys want to play board games. Maybe you actually play cards. Or your technology, maybe you just have to get some extra chargers to keep your phones and your iPads charged up. There's no medication, okay? There's no medication that you can take for this. There's no antivirals like with the flu that you can take Tamiflu to make it go faster. There's nothing at this point, there's nothing for this. So whether you get tested or you don't get tested, you're going to do exactly the same thing. Now, if you get sick or you're in the high risk group, and you start feeling really sick and you start feeling short of breath where you can't catch your breath or you get chest pain or anything like that, that's an emergency. okay, that's when you think about going to the hospital. And you should try to call ahead of time, call your doctor, obviously, call ahead of time, talk it over. Your doctor will probably tell you, yes, you have to go to the emergency room. I have notified them. When you get there, tell them who you are, and they will isolate you and take you through a different area so that you don't contaminate and stay hacking and coughing in the middle of the waiting room and contaminate everybody else that's there. Okay, so that's for the emergency. Now, obviously, if you start having shortness of breath and or chest pain and you feel it's life-threatening, then of course you're going to call 911. But you shouldn't call 911 just to get a free ride to the ER. And that's something you need to tell your neighbors and everybody else. Don't panic and say, oh my God, I've got to get 911 to take me there. Because that means that's a whole ambulance or a whole fire truck that then needs to get decontaminated, and you're taking all those fire rescue folks out of commission. So we need to realize that once this thing revs up more, and we will have more positive patients in the community, that those resources are really very precious. Okay. And you got the next slide. That's it. Okay. So the answer for the testing and the other question I have here is, how can Palm Beach increase its testing numbers and capacity? That's a very, very important. We've been fighting. We actually had a request that the governor finally, not the governor, the Surgeon General put in a request for a federal site. The reason they are denying it is because we're considered a region. We're Region 7. Region 7 consists of the Keys, Miami, Broward, and Palm Beach, and they say you have one already in your region. Go there. That's not practical, and that we're not accepting that as an answer. We're going to keep pushing for it. That's what the politicians are for. I'm not political one way or the other. That's not me. You guys, those who know me, know me. But through the political process that is continuing to push forward, we definitely deserve one. We also have a 25% of our population are senior citizens, and the senior citizens are very vulnerable for this. So we have to get a testing site. In the meantime, until we get the testing site, we will try to open more local, smaller sites that can help. There are also some urgent centers that are already testing. You can call and find out who's testing and who's not, but the urgent centers have really stepped up to the plate. You need to call ahead of time to be seen, because one of the things that you can do is go and find out if you just have the common flu versus COVID, and they can at least tell you that. So the other question here is, in a communal environment where isolation is impossible, what do you recommend? What do we do with suspect COVID with mild symptoms? So I think the second part, if you're a suspect, if you have symptoms, you're going to be treated as if you were. You're going to stay home for the 14 days and isolate. Now, when you say an environment that you can't isolate, let's say you have a small apartment where you really can't go into a separate bedroom, I would just try to maintain that 6 foot distance. If you're coughing a lot, the person who is coughing is the one that should put on a mask. I know there are no masks available, so what do? You can use a handkerchief. You can use any material that you can put over your mouth and nose so that you're not coughing and or sneezing. If you happen to have silk scarves at home, those are very useful. That's what used to be used in the olden days when there wasn't fancy masks. The silk has very small pores, and so if you layer 2 or 3 layers of silk, it has the same protection as an N95 mask. The only reason that masks protect you is not the paper that's magic, it's the size of the hole of the pore. And so N95's mask is the equivalent to layers of silk put on top of it. So those are just suggestions and things that you can do. And anything that you can do to isolate, to keep yourself apart is better than nothing. So in an ideal situation, to go into your little The last question I have has to do with reinfection. Viruses usually give you a lifetime or a very long protection because now that you have the antibodies in your body, you cannot get infected again. So some people have the old chickenpox theory and they say we should just all get this and get it over with. Well, we could do that actually. And most of us would then be protected for when this comes around the next time. The only problem is you're going to lose about at least 4% of your population. That population, that means that we lose about 192 million people. 1,920,000 people. Let's say 1 million people. And those people are going to be your grandparents and your parents. So I don't think that, although yes, that is a logical conclusion, let's just all get this and get it over with. I'm not sure that for the people that we're willing to let die, that's an option. So you can put yourself, if you're young, maybe that's the answer. So maybe we shouldn't let young people run the medical system yet. Let me at least retire and go to heaven. Then you can do that.
You want to talk about
You've got, is that what
Yes,
you got your strategy here? Let you
Okay.
talk. I think they're bored now. Let me talk anyway.
All right. So we should go move forward and talk a little bit about isolation and what our strategy for isolation is. Number one, we are monitoring hospital beds and ICU beds. And so part of our strategy for making sure that those beds are open is to identify places where after individuals are tested, they can be isolated. Now, there are three types of isolation rooms or quarantine type environments that we have to consider. If an individual is tested positive and they are exhibiting symptoms, then we're going to need to put them in their own room, their own bathroom. And usually there is a kitchenette or something that we like to place them in. And we've had a tremendous response from hotels and motels that are willing to work with us. So we feel really good about our ability to help those individuals who are not able to pay for their hotels and motels, but we'll have a process in place to vet that. Two of you have individuals who are have been around individuals who have COVID-19 and they are exhibiting symptoms. They'll also need to have their own room, own bathroom. They'll need to be separated and closely monitored, because if the symptoms get worse, then obviously they would need to go to see a medical person. But then if you have individuals that are coming from New York or coming from other areas throughout the country, or individuals who have taken a cruise and now they need to self-isolate, we are looking to develop a congregate facility that would still allow them to use social distancing, but would also give us the ability to.
I'm sorry, you have the wrong number. This is a business phone
multiple
number.
people at once. And so we're exploring congregate settings for those individuals. If indeed they're not experiencing symptoms and they just need to self-isolate and they can't go home, which is what our first line of defense would be, is for them to go home and to self-isolate at home. If for whatever reason they can't do that, then we would look to explore some congregate setting for them. And if they're exhibiting symptoms, they would be self-isolated at that congregate setting, or we would have to move them to a room separate at a hotel or something, or if needs be, to see a healthcare professional. So the way that works is the hospital or the provider, healthcare provider, would notify
Can you
public
take a
health.
picture of that or
So they
send
would
it to me?
notify the health department. The health department, yeah, somebody is not on mute, but the health department would then, and based on their assessment, they would then recommend that these individuals are isolated. So they would contact the Human Services branch, and we would work in conjunction with them to make sure that those individuals are self-isolating and communicate the location of those individuals. And then the health department would then track them. So the strategy is to test, to find out where they are, to isolate, and then to track and to monitor so that we can slow the spread. So we have some questions we constantly have questions about how is this going to impact homelessness and the Fairgrounds Road project. We're going to move forward with that project. We haven't experienced any delays in getting that and moving forward. If we do, we'll communicate that. But so far, we're going to continue to move forward with that, opening up that shelter at Fairgrounds Road. And obviously, the state issued an executive order, and there are a lot of shops that are closed and businesses that are now closing. Those businesses that are deemed not critical to helping us move our mission forward. Virginia doesn't like to use non-essential, but certainly we want to do what we can to prevent the spread. And so we are really taking steps here in Palm Beach County to limit the number of places where people can go and congregate and spread this particular virus. One of the things that we're working on is transporting these individuals. So if they don't have transportation, we're working on some strategies to make sure that we can transport them safely to their self-isolation facility. See if I can move on to the next screen here. Okay. All right. So I just want to talk a little bit about what we're doing to maintain services. It's important. So for community services, we're accepting online applications. So we want to make sure that people still have access to critical health and human services. So if they need utility assistance, if they need rental assistance or other emergency services, electric assistance with bills, they can go online to pbcgov.com/Oscars with 2 S's at the end, and they'll be able to apply online. If for whatever reason they are unable to utilize that online application, obviously you see that they can call in. The number is there on the screen, 355-4792 for those of you who are on the phone and not the webinar. And if they need rental or emergency assistance, they would call the Lewis Center at 561-904-7900. The Lewis Center right now, they're not accepting additional clients, but they are still working to place individuals in permanent housing setting. Also, if you have any questions, you can reach out to us via website at pbcgov.org/community services and just hit the contact us button, and we have someone that's monitoring those questions. Finally, as it relates to community services, we have closed down our senior centers and our daycare centers. So we have turned those centers on the north and mid-county and out west into distribution centers. So our congregate meal sites, we had about 18 of those. Then 3 of them are also day centers and senior centers. What we have done now is we're having the food delivered to those senior centers, and those individuals who used PalmTran to come to those centers and the congregate meal sites, PalmTran is now delivering those meals directly to their home. Those who drove to our senior centers and our congregate meal sites, they can now all drive to our senior centers, and they can pick up 2 weeks of shelf-stable food. And we're going to be doing that until to open back up for business. So if you need more information about where our senior centers are located, you can go to pbcgov.org/community services and find that information. I do want to talk a little bit about what we're doing for our residents of John Prince Park and other parks, and other individuals who are on the street. We are following the guidance from the Center for Disease Control on unsheltered homelessness. So you can find that information at the link here. And we're not clearing the encampments at this point. We are encouraging them to set up their tents 12 feet apart, and we have restrooms that we're continuing to stock and make sure that the supplies are there and that they're. We are also distributing all types of educational material and encouraging social distancing. One of the things that you'll see if you go up to the parks are signs, basically are making people aware of what we're dealing with, and we're having our hot team members pass information out to those individuals as well. We are bringing out standalone hand washing stations and more sanitation stations for them. We are continuing to allow the churches and other permits to distribute food to those individuals. We also have the Lord's Place and others who are continuing to work with Cafe Joshua and St. Anne's to provide meal. And we're looking to our mobile showers and mobile van out to the facility. So the mobile showers should be out within the next week or so. And we're going to have a conversation, I think tomorrow morning, with the healthcare district to coordinate bringing out the mobile van so that they can do testing in the park. And so just a little update. We are making sure that we are focusing on individuals who are homeless during this crisis, making sure that they can maintain sanitation, their health as well. If they need to isolate, if they are presenting, if they need to isolate, then we'll revert back to our isolation strategy. So we're organizing that from the Emergency Operations Center, not necessarily from the Department of, again, there are a lot of different things that we're doing to focus on the homeless population included, and we're going to be doing our national association. So as all of these policies are being passed at the federal level in terms of giving money out to individuals and how they're going to get it, we're making sure that there's some guidance sent to the state and federal government to ensure that our homeless population, that they're not left out. A little bit about what we're doing around food. It's a more simple way to think about it is there are individuals who they can call the elder hotline, and there's a process that we'll go through and get connected to food. If they are not seniors, they can call 211 and they have a process. But just know that that's something that we are working on. We have a plan, a draft of a plan already, and we've had maybe 4 or 5 conference calls in the past week just to organize and strategize. We want to make sure that we've identified those pockets of seniors. So we have areas overlaid with all of the senior facilities in the entire county, and so we know exactly who is at risk. We're making sure that we're communicating to those individuals and those senior complexes, get pertinent information to them so that if they're in need of food or water or those types of things, they know who to call. We are working with the south end of the county and others so that they can do the same in converting their current meal sites into feeding sites where there's in-home delivery. We're also working with all of the stakeholders to make sure that there's enough food available and that we're coordinating in a very efficient way and a safe way to prevent this spread of COVID-19. We're looking to make sure we can ramp up benefits for SNAP, so maintain benefits for seniors and increase benefits enrollment. We're developing a communications plan to ensure that our municipalities, our faith-based entities, our low-income community, our nonprofit partners, that you guys are all in the loop in terms of what our strategy is around food. And so this next screen is a more simpler process that you can consider. Again, if there is a senior, they call 1-866-684-5885. That's 866-684-5885. Helpline will then do an assessment. If a senior needs access to food, they'll contact one of the major community services, associations, or neighborhood, and then they'll do an assessment and connect them to a congregate meal site or in-home delivery. And if not, we're working to get this wait list taken care of. And so there's some guidance that's come down from the state that will relax the eligibility requirement for food and will allow us to serve more seniors from a congregate meal setting or deliver it to their homes. So just know that we're working diligently to clear that wait list and to make sure that seniors have access to food. And if they're not seniors, they can call 211. We've updated all of the pantries. We're working with Feeding South Florida to make sure that there's plenty in stock, and the Palm Beach County Food Bank, who's working very diligently to ramp up and to prepare. You've seen a lot on the news and some other correspondence coming out by them, all working to make sure that they're waived for seniors and for vulnerable residents to access food here in Palm Beach County. So you'll get a copy of this PowerPoint, which kind of gives you a flow of how they can access food if needed. So again, if you do run into someone that's homeless and needs to be tested, they're exhibiting symptoms, you're going to go right back to that screen that we talked about before. Have them call their provider. If they don't have a provider, have them call the number that's on the screen. I'll give that to you again before this call ends. So I want to talk a little bit about transportation. And right now, Palm Tree is offering free transportation. So you can go to their website, which is listed here in the little white part, palmtran.org. And you can access free rides. So let your clients know that. Let anyone that is in need of transportation know that that is the case. We are, again, looking for entities who can transport individuals who are infected with COVID-19 or experiencing symptoms. So if you run a transportation organization, and you want to talk to us a little bit more about that and hear about what other communities are doing in order to transport individuals in a safe manner, we're happy to speak with you about that. Just reach out to me directly at 561-565-4703, and we can give you that information. As it relates to behavioral health, I believe John Hewlick is on the line. Well, before I go back to that, Julie Crefo, I don't know if Julie is on the line. I can't see all of the names that are on here. But if Julie Crefo or anyone else, if you have any additional information that you'd like to share, you are organizing this food strategy, please let me know. I don't know if Doris will be able to unmute you or find you on the call.
James, I'm on. Can you hear me?
I can hear you, Julie. So is there any additional information you'd like to add?
Yes, thank you, James. And your update was great about hunger, what we're working on. Just wanted to add that there are meals available for kids at the schools starting on Monday, the 30th. It will be, 33 schools in the county. They'll be doing a grab and go model at each site. The kids will get a bag that has breakfast, lunch, supper, and a snack in it. It's probably on their website. I've also provided lists to our 150 partners in hunger relief, but if anybody needs it, James, on this call, I'll email it to you and you can get it out to them. We also have this week, the school district is at 27 sites between 11 and 1. Their pickup times are for next week as well. They have a breakfast and a snack available. That's all they could do since it was spring break, and these are all reimbursable meals, but those are available tomorrow, since tomorrow's the last day of the week. And Flippany has been asked by the Florida Department of Agriculture and Consumer Services to add additional summer break spot sites, which is the alternate meal while schools are closed, deeper into the community. Our hunger relief team has been working hand in glove with them to identify those sites, partner with community partners in each of our most at-risk cities, which is a list of 15. Flippany's been out there serving breakfast and lunch. We have the schedule that I'll send to you, James, for tomorrow. And then they'll be doing the same meal service all next week and into the date that schools are right now closed until April 15th. Of course, we're waiting to hear what's happening from there. But beyond that, if the schools are still closed, Flippany will still continue serving meals by next week. They just ramped up this week, putting it all together. Again, with us helping them the deep dive into the communities. And by Wednesday of next week, they expect to be serving 3,000 kids. They've served 1,600 meals alone yesterday, just in their third day. So that's really ramping up and expanding. So check the website for the school district for their locations. But again, I'll send James the list of the schedules so folks, if they want them, can have them. I don't know yet because I've got so many things going, but I did send them to our United Way marketing folks, and I'll double check if that list is up on our website yet or not. Otherwise, you've covered everything else.
Okay, very good.
Yeah.
And Karen, I don't know if you're on from the food bank or Paco from Feeding South Florida or any of our other providers. I did touch base with Karis out in the Glades Initiative, and they're ramping up. I know that she's going to need some help out in Western Palm Beach County, but we have kind of checked in with some of our major food banks, cross ministries as well, some of our major food providers, and we know which providers have closed, and we also know which ones are remaining open and what their needs are. So just know that we are organizing as a community to make sure that those needs are met. All right, so we don't have any other comments around food. John Hewlick, I know you were on. I don't know if you're able to unmute yourself and to say a few words.
Hi, James. Can you hear me?
Yes, we can hear you.
Oh, great. Hey, thanks, James. And I wanted to thank Dr. Alonso, the county and department administration for their leadership during these challenging times. And I particularly wanted to thank the behavioral health community who are clearly adapting, adjusting, and demonstrating a lot of courage as well as skill and ability to maintain services. Out of necessity, of course, many of these services are being conducted via telehealth. There have been some administrative adjustments at the state level, managing entity level, and at the local level and to ensure providers continuity and sustainability during these times. We are, as a provider community, working together collaboratively. A whole host of providers are participating on a large conference call 3 times a week, Monday, Wednesday, and Friday at 8:30 a.m. To troubleshoot any concerns. It's a great time to address these, and the follow-through has been very significant. I note from the screen there is a resource and a reference to free telemedicine. Of course, again, that's a wonderful service to access. And I know there was a question earlier about whether this slide would be distributed. I assume that it will be, and I will make sure that on this slide we add some additional very important resources to this slide. From a consumer perspective and actually a provider perspective as well, 211 Palm Beach has a specific coronavirus webpage with some great information and resources. And again, they're doing yeoman's work in ensuring that folks that are reaching out for help at this critical time are being referred to services. We'll make sure that information is included on this slide. We will want to also ensure that many of the providers are likely aware of this already, but we want to make sure that they have easy access to it. But the Federal Substance Abuse Mental Health Services Administration has a very clear guidances on things around HIPAA, continuity of service, and the like. We'll make sure that hyperlink is incorporated. Additionally, AHCA, the Agency for Health Care Administration, has launched a resource page for all of their COVID-19 alerts for facilities and Medicaid providers. So we'll be glad to ensure that those resources are available to the participants today. So that's it for me, James. Thank you very much.
Thank you, John. I'm going to let Dr. Alonso I guess there are a couple of comments that Dr. Alonso wants to.
Yeah, I'll do the first one. It says, in a communal environment where isolation isn't possible, what do you recommend we do with a suspect COVID with mild symptoms? Whether you have mild symptoms or severe symptoms, your answer is going to be the same. That person needs to stay as far away from the rest of the people. And in the case of a person who's coughing or sneezing, having a temperature, the mask should go on the individual who's having those symptoms. If you do not have a mask, then I would repeat, use whatever you have possible in that location, or give that person whatever you have to be able to cover up the cough and the sneezing. The second part to that would be, it would be critical for that person to be disinfecting the hands as much as possible. You're not going to catch this through the skin, but obviously if he's coughing, he may be bringing his hands to his face, which again, why a mask would be so important. But any saliva or anything that he puts on his hands would then be transmitted to other people. So the cleaning, the disinfecting, the hand washing, those are very difficult to do those things if you are an outsider, you're camping and all this kind of stuff. So the answer is, you're going to do the best you can, give them as much information as possible. It's not perfect, but those things can be accomplished if a person is being very, very careful. The reinfection, I think I mentioned that already, but it's not likely that a person is going to have reinfection. It would be more logical that a person would be immune for quite a long time once you do catch the virus.
All right, we're going to move on to some dates. We're going to have Julie. Give me 1 second here. All right, so we're going to have Julia, the executive director from CareerSource, to give you an update on how we can kind of stay ahead of the unemployment surge that we're expecting. So, Julia, I don't know if you're unmuted, but it's your world.
Can you hear me okay now?
Yes, we can.
Wonderful. All right. So James, first of all, thank you so much for having me. This has been a lot of great information for everybody. So one of the biggest concerns right now in the county is unemployment. Everybody feels like they're losing their jobs, they're staying at home. So up to this point, we've had a really great economy, which is a great place to start. But as we have a virus, as Dr. Alonso alluded to, that is transmitted through human contact, obviously all the jobs that are related to human contacts, such as hospitality, leisure, and retail, are going to get the hardest hit. We're seeing hotels, restaurants, malls closing, stores closing for a month at a time, people being laid off. That's kind of a panic into the smaller businesses that feel like they have to close their doors right away and lay off people. So we are seeing a surge in people being laid off, and we're trying to work with the businesses to say, you know what, that your employees are very valuable. Let's try to keep them, because when When we're on the flip side of this virus situation, you're going to have to reopen your business. And then when you do that, you've lost your most valuable commodities, which are your employees. A lot of business loans are coming out where businesses will be encouraged to keep their employees, but also get financial benefits. There's a lot of money coming down from the government to help businesses. Our webpage, which is careertipspbc.com, has that information for individuals that have lost their employment, but also for businesses to retain their employees and to see what financial assistance there is. This has affected all of us and our partners that we work so closely with. So I have to say that probably the biggest misnomer here is that Career is the unemployment office. We are not the unemployment office, and we haven't been for over 10 years. So when people come to our doors, there's nothing we can do for them except let them use our computer. The webpage for unemployment and to apply for unemployment is floridajobs.org. And there's when you go to our website, we actually put it up there for you with the 1-800 numbers. That is how you apply. Right now, it is inundated with calls and applications, so to get through is very tough. It's been going up and down all day because they're trying to fix it at the state level. But that is what we're looking at right now. We're looking at some of the businesses losing we're looking at about 10% of losses in our businesses as far as employees go. So, we still have to isolate. We still have to take care of our employees. A lot of companies have thought about how do we virtually work. So the virtual platforms are exploding. Everybody's going on to virtual meetings. I mean, telemedicine has been kind of talked off in the background, and now it's in the forefront. I just saw teletherapy. That's the first time I saw that. So businesses are going to get smarter. They're going to do more in the virtual world, and people are going to be starting to buy computers and scanners and laptops and everything for their homework or teleworking. So we're going to see a big change in the employment as well as in the business industry on the flip side of this. People are going to work more virtually too. So we're going to see new jobs that we've never seen before. People are going to be more entrepreneurial. They're going to work off of job sites, picking jobs here and there. We call that the gig economy, where people will do J jobs or jobs that will give them money temporarily and move on to another job. So it's going to be a very interesting picture on the flip side of this. But right now, we're probably seeing more of our significant job losses in hospitality, leisure, and retail, and probably an uptick in IT and telecommuting. So those are what we're seeing right now. And again, if anybody is unemployed or needs reemployment assistance, the Florida Jobs website at the state is where you go for applying for unemployment. So I hope that helps everybody out.
All right.
I don't see any questions. So.
Very good information. And I mean, I guess that's why they call me, I'm always an optimist, because I said this the other day. I said, wow, we actually got the state and the county to let us work from home. Wow. That's definitely the way the world's going to go, no question. The telemedicine has been fantastic. When they did that to my nephew's son this morning, it was great. Really, really good. I have a thing here I want to make sure we share. There are more and more of the walk-in clinics that will be actually testing. We had a call that was put in, said Helix Urgent Care and MedExpress Urgent Care are taking calls to screen for the test. So you call first, you give them your symptoms and your information, and if you fit the qualifications for them to test you, they will have you come in and test you. But you got to call first so that you go in properly. If you walk in and just walk into the place, they're going to throw you out for not calling in first. So please call first.
Thank you, Dr. Manzo. All right, Randy Paleo, if you're on, you would give us an update on the funders group and some of the things that you guys are discussing and where you are in the process.
Okay, I assume everybody can hear me.
Yes.
I'll try to keep this brief. Thanks, James. I don't think there's a lack of awareness of the application that we made available because we have received over 240 applications requesting over $11 million So there's, I think, quite an awareness. I'll assume most of the people on this call are already aware of that. If you have not, simply go to the Community Foundation's website, and you can find the application there and simply fill it out. To be clear on what the coalition of funders is doing, similar to past hurricanes, there's a group of funders, and I don't want to miss anybody, so let me make sure I'm reading them off. Allegheny Franciscan Ministries, the Children's Services Council, Community Foundation, Jewish Federation of Palm Beach County, Lost Tree Foundation, Quantum Foundation, United Way of Palm Beach County, and also the Pew Education Fund, have all committed to looking at these applications and considering funding of the applications. We also are coordinating with others, including James's office and the Youth Services Department of the county, to also get input, not so much to fund those applications, but coordinating the decision-making process. Just so people are clear on what that is, it is a common application process. It is not a pool of funds. So the application that you filled out or may fill out is reviewed by those different funders, and then they make their own decisions from there. So you may be contacted by one of those funders with some questions. Everybody kind of has their own processes and their own steps in their process of being able to cut a check to somebody. So they may need more information than was in the application, and they'll contact you directly. And if you're funded by one of those, they will contact you, and they will cut the check themselves. And whatever reporting requirements would also be up to those individual funders. So I just wanted to be clear that everybody understood it's a common application process. It's not a funding pool. If a couple of those organizations are receiving donations, and that is how they are funding those, both the Community Foundation and United Way. So if you're directing anybody who wants to donate in a very general sense and have that sorted through, they both are receiving donations. United Way also wanted me to also note that they still do register volunteers, and we'll coordinate that. And the only other thing I think I wanted to note, and then I do see a question on here, is to be on the lookout for the new stimulus package, I guess it's called, from the federal government. I believe it is called the CARES Act. And actually, Julia may know more than I do about this, but I did see in an initial summary of that there will be loans available to private and nonprofits, and that is typical in times of disaster. However, a change that I did see that I think is important for the nonprofits. I know in the past, SBA loans have not been that attractive without knowing how you would pay them back. However, it looks like in this package, there will be a forgiveness process that if you maintain your employees and continue paying your employees, there'll be a forgiveness of that loan. So I assume that might make them much more attractive or interesting to nonprofits than maybe past disaster SBA loans have. The question I see here is, can we get funding from more than one organization? And that is a definite yes. And that's really actually one of the reasons why many of these funders are doing this process, is to coordinate our funding and try to make the money go as far as it possibly can, rather than different organizations all doing their own separate processes. So definitely, it's not uncommon at all that your application may be funded by more than one. And I think also, if you heard the numbers that I said at the beginning, I should also be realistic that I don't think all of the applications, and certainly not all of the requests that were in the applications, are going to be able to be addressed. The need is very great, and all the funders are committed to doing as much as they can.
Okay. Julia, is there anything you wanted to add to that?
So, can you still hear me?
Yes.
Okay, great. So anytime a natural disaster or any kind of disaster occurs, the government definitely throws money in your direction. And especially for small businesses, there is a small, right now in the stimulus and emergency supplemental plan, the small business loan interruption program, they're going to probably put $350 billion into that. They have a paycheck protection program. Small businesses and other entities will get zero free loans up to $10 million. And that covers about 8 weeks of average payroll and other costs that will be forgiven if the business retains their employees and their salary levels. So that's important to know. And any principal and interest is deferred up to 1 year, and fees are waived. So we see things trickling in, and as this continues, we'll continue to see more assistance to the small businesses and to other employers, and unemployment will be expanded. So we're already talking about unemployment raising up to $600. Now, mind you, people have to be eligible and apply. So we're seeing money filtering in, and I know that afterwards there'll be a lot more coming through, especially if this is, this stimulus package is completed and passed. There'll be direct cash assistance too as well. So just stay tuned.
I'd like to make a comment to remind people that this event has just started. I remind you back to H1N1 that it actually took 3 years before the virus actually started coming down. Now, none of you remember anything like this back then. This did not happen back then. I think a couple of things have made this, well, again, I don't want to get political at all, but I'm just saying that the heightness of pending doom that has been created has made this seem like we're in the middle of doomsday, but this has just started. So the fact that the stimulus package was passed so quickly is really quite amazing. These things usually take years and years before we even get a paycheck. So somebody's not muted, but this will take some time before we get back to normal. I just want to make that point. There's also a question here that mentioned they wanted me to clarify again. Somebody calls in.
I wonder if I put for Kim for them to see Kim.
Whoever's
I don't
talking
think I set it up.
Hello?
We can't hear you.
No, we can't hear anything.
Okay, can you hear me now?
Yes.
Oh, but you can't answer. Okay. So that's the point, that you just call either the doctor's office, or the urgent center first. And then they will give you directions how to come in, and they will also tell you who they will or will not test. I hope that clears it up. Thanks.
And again, the number that they would call is, even if there's someone that's homeless that needs services, if they can call 561-840-4500. Again, that's 561-840-4500, and they'll be able to
What
get.
number is that?
This is the number that the health.
No, that's the
Okay.
wrong number. That number will put you at the health department. You
Right.
need to call the urgent center that you want to go to. The health department is just going to tell you exactly what I just said.
Okay.
Call your doctor, call the urgent center. So that 840-4500 is our main number. That's the number that goes over at night to the service to talk to the epi people from the hospitals and all that. So call the place where you're going to go to be seen, or where you're going to send a client who is ill, so that they can tell you whether or not they're going to test them. No sense sending them there if they're only testing 65 and over.
Right.
Okay. Thanks.
All right. So again, what we're planning to do here from the Emergency Operations Center is, and yeah, I see the healthcare district's number is 561-642-0500. it looks like 2,100. We'll get that number to you. Or 642-1000. So we're going to try to keep you guys informed of what's going on here at the EOC, and specifically around isolation.
We lost you again. Lost you.
Able to access the services that are critical to this community. Again, thank you all for your participation and support. We'll send out another notice for next Thursday around 1:30 to give you another update because things are changing very rapidly. We want to continue to communicate pertinent information to you as things develop so that you'll be in the loop and you'll be able to share that information with your staff and some of the clients that you're serving. And so again, next Thursday around 1:30, we'll have another conference call. There'll probably be a few other topics. We'll give you updates on how we're still maintaining access and any additional information about what's happening with this coronavirus here locally and throughout the state and country. And then try to hear from you in terms of what you need in order to continue to do your work and how we can support your efforts. So with that, I just want to say again, thank you all for tuning in. We're going to have another platform. We were only able to get 200 people on this particular platform. And so I got emails from people saying that they couldn't get on because it's full. So we will we'll change the platform so that we can add additional people, and we'll be able to communicate this information to you all. And we'll also send this information out via email. So thank you very much. I appreciate everything, and we'll see you next week around the same time.
Thanks, James.
Thank you.
Thank you, James.